Dr. Alastair Finch liked the sound of his own voice. It was a rich, resonant baritone that filled the sterile confines of the Prometheus Wing's primary observation theater, a sound he believed carried the very weight of authority. He stood, a titan in surgical scrubs, before a gallery of residents and interns, his audience captive. They were young, impressionable, their faces a mixture of awe and fear, and he cultivated both emotions with the precision of a scalpel. He gestured with a broad, confident hand toward the bank of monitors, displaying the vital signs of the patient in the adjacent recovery suite. The patient was not just anyone. He was General Marcus Thorne, a man whose name was a foundational stone in the modern military's edifice, a living legend recovering from a routine, albeit delicate cardiac stent procedure. "Observe," Finch declared, his voice echoing slightly off the polished chrome and glass. "Perfection. The metrics are flawless, the recovery vector is optimal. This, ladies and gentlemen, is what happens when confidence and expertise intersect. There is no room for doubt in this theater. Doubt is a cancer. It hesitates. It second-guesses. In our world, hesitation is a death sentence. You must operate as an extension of pure will." He paused, letting the weight of his pronouncement settle upon the room. His eyes scanned the faces before him, landing on a small, still figure at the very back of the room, almost lost in the shadows cast by the towering diagnostic machines. Nurse Alara Vance. She was a recent transfer, a ghost in the hospital's complex ecosystem. She did not participate in the ritualistic social posturing of the medical staff. She did not laugh at his jokes or nod emphatically at his pronouncements. She simply existed, a pocket of silence in a world of controlled noise. Her uniform was immaculate but unadorned, lacking the small pins and personal affectations other nurses used to soften their clinical appearance. Her posture was one of absolute economy. Not a single muscle seemed wasted. She stood observing the same monitors as everyone else, her expression a perfect mask of professional neutrality. This stillness unnerved Finch. It was an absence of reaction, a void where he expected to see the reflection of his own greatness. He interpreted it, as men of his particular constitution always do, as a challenge, or worse, a deficiency. "Nurse Vance," he called out, his voice sharpened with a derisive edge. The heads of the junior staff swiveled in her direction. The spotlight was now on her, and he relished the discomfort it would surely cause. "You've been remarkably quiet. Do you have anything to contribute, or are the complexities of post-operative telemetry beyond your grasp? Perhaps you are simply overwhelmed by the presence of greatness?" A few of the more sycophantic residents chuckled nervously. It was a cruel, unnecessary jab, designed to publicly assert his dominance by highlighting her perceived inadequacy. Alara Vance did not flinch. Her gaze remained fixed on the monitors for a full 2 seconds after he had spoken, as if finishing a silent calculation. Only then did she turn her head, her movements fluid and deliberate. She did not look at him with fear or anger or embarrassment. She simply looked at him. Her eyes, a pale and piercing gray, held a disquieting depth, like looking down a deep, cold well. "The general's potassium levels are trending low, and there's a fractional widening of the QRS complex," she stated. Her voice was low, clear, and devoid of any emotion. It was not an opinion or a concern. It was a statement of fact, delivered with the dispassionate finality of a machine printing a diagnostic report. Finch felt a flash of irritation. She had not addressed his insult. She had sidestepped it with data. He waved a dismissive hand. "A negligible fluctuation. Well, within acceptable parameters for a man his age, post-anesthesia. It shows you can read the numbers, nurse, but can you interpret them? Can you see the tapestry, not just the threads?" He turned back to his audience, a magnanimous smile plastered on his face. "You see? This is a classic example of textbook knowledge without instinct. The art of medicine is not in reading the chart. It is in reading the patient. And my instincts, honed over 2 decades of saving lives, tell me that General Thorne is perfectly stable." He was the roaring bonfire, all heat and light and noise, and she was a shard of obsidian, cool, silent, and impossibly dense. At the side of the room, Dr. Ben Carter, a first-year resident, felt a prickle of unease. He had noticed the same subtle anomaly Vance had pointed out, a whisper of a problem in a symphony of otherwise stable data. But he, like everyone else, had been cowed into silence by Finch's overwhelming self-assurance. Finch was a legend at Ethelstan Memorial, a surgeon whose ego was matched only by his reputation. To question him was to question the institution itself. Yet, Carter found his eyes drawn back to Vance. She had turned her attention back to the monitors, her body once again a study in absolute stillness. She was not cowed, she was not intimidated, she was watching, waiting. It was the posture of a hunter, not of prey. The air in the observation theater was thick with the scent of antiseptic, filtered air, and Finch's suffocating arrogance. He continued his lecture, his voice a rolling tide of self-congratulation, each word a brick in the monument he was building to himself. He spoke of his decisive actions, his intuitive grasp of complex physiology, his unparalleled surgical skill. The junior doctors hung on his every word, their notebooks filling with his pronouncements as if they were divine scripture. They were learning how to be doctors in his image, loud, certain, and unassailable. They did not see the subtle flicker on monitor 3, the almost imperceptible arrhythmia that lasted for less than a second. But Ben Carter saw it, and from the corner of his eye, he saw Nurse Vance's hand move, just a fraction, to rest on the edge of a stainless steel counter. It was the only part of her that was not perfectly still. It was a small, almost invisible sign of readiness, like a predator coiling its muscles before the strike. Finch was mid-sentence, describing a particularly brilliant suture technique he had employed when the first alarm blared. It was not a loud, panicked siren, but a sharp, insistent chime, the kind designed to alert, not to alarm. On the central monitor, General Thorne's heart rate had suddenly spiked, a frantic, chaotic rhythm replacing the steady metronomic beat. Finch stopped, a flicker of annoyance crossing his face, as if the patient had dared to interrupt his monologue. "A momentary ectopy," he announced, his voice still laced with confidence, though a hairline crack had appeared in its foundation. "The heart resetting itself. It's of no concern." Then, a second alarm joined the first, a lower, more guttural tone. The general's blood pressure was plummeting. The clean green lines on the display began to look like a seismograph, reading during an earthquake. The room fell silent. The only sounds the escalating electronic shrieks of the monitors. The sycophantic laughter died in the throats of the residents. Every eye was now fixed on the screens, watching the data paint a portrait of catastrophic systems failure. The tapestry Finch had spoken of was unraveling with terrifying speed. Finch's face, which had been a mask of smug certainty, began to lose its composure. A sheen of sweat appeared on his brow. Get me a crash cart in there," he stammered, his voice losing its resonant authority. He was pointing, but his gesture was vague, unfocused. He was speaking to the room, to anyone, a king suddenly finding his throne collapsing beneath him. The junior staff looked at each other, a wave of panic and indecision paralyzing them. They were acolytes, whose god had just been revealed as immortal. They had been taught to follow, not to lead. It was in this moment of collective paralysis that Alara Vance moved. She did not run. She did not shout. She flowed from her position in the back of the room toward the door of the recovery suite with a terrifying, silent grace. Her movement was pure economy, a study in vectors and momentum. As she passed the main console, her hand shot out, her fingers dancing across a series of touchscreen controls. She silenced the non-critical alarms, isolating the core audio alerts to heart rate and oxygen saturation, cutting through the cacophony to leave only the most vital signals. She adjusted the telemetry feed, bringing up a deeper diagnostic screen that Finch had ignored. It took less than 3 seconds. "Get the cart," she said, her voice cutting through the panic like a diamond blade through glass. She wasn't looking at anyone in particular, but her command had an absolute, undeniable authority that Finch's blustering had lacked. Dr. Ben Carter, shaken from his stupor, was the first to react. He and another intern scrambled to wheel the heavy stainless steel crash cart toward the suite. Finch, seeing his authority usurped, bristled. "Who do you think you are?" he bellowed, his voice cracking with a mixture of fear and rage. "I am in charge here. I give the orders." Vance did not even spare him a glance. She was already through the door and at the general's bedside. The man on the bed was convulsing, his body racked by the violent, uncoordinated firing of his heart muscles. Ventricular fibrillation, the deadliest of arrhythmias. He was, for all intents and purposes, already dead. His skin was a waxy gray color, his lips tinged with blue. The air was filled with the smell of ozone from the defibrillator paddles charging and the metallic tang of fear. Finch stumbled into the room behind her, followed by Carter with the cart. "Paddles! Charge to 200!" Finch yelled, grabbing the defibrillator paddles with clumsy, shaking hands. He was performing his role, shouting the lines he had learned, but there was no conviction behind them, only panic. He was an actor, forgetting his lines in the middle of a play. Vance, however, was already in motion. She had bypassed the paddles. Her eyes were locked on the new diagnostic screen she had activated from the observation room. It showed a hyperacute T-wave, a telltale sign of hyperkalemia. The low potassium reading she had noted earlier had not been a minor fluctuation. It had been the harbinger, the first tremor before the earthquake. The IV drip Finch had ordered was a standard saline solution, which was doing nothing to correct the underlying electrolyte imbalance. In fact, the stress of the fibrillation was causing the general's cells to release more potassium into his bloodstream, creating a feedback loop of death. Shocking him, she knew, would be like throwing gasoline on a fire. It might momentarily reset the heart, but the toxic biochemical environment would immediately send it back into chaos, weakening the cardiac muscle with each successive, futile shock. "No," she said. The word was not a suggestion. It was a command, cold and absolute. She placed her hand on Finch's arm, her grip surprisingly strong, stopping him as he was about to press the paddles to the general's chest. For a moment, he stared at her, his mouth agape, utterly dumbfounded that a nurse, this quiet, insignificant woman, would dare to physically stop him. "It's hyperkalemia," she stated, her gaze flicking between the monitor, the IV bag, and the general's failing body. "The shock will be ineffective and cause further myocardial damage." Her diagnosis was instantaneous, a flash of pure, cold logic in a storm of chaos. She released his arm and turned to Carter, who stood by with the cart, his eyes wide with a mixture of terror and awe. "Give me 10 units of regular insulin and 50 milliliters of 50% dextrose. Now," she commanded, "and 1 ampule of calcium gluconate. Push the calcium first, slow push." Her instructions were precise, confident, and utterly contrary to the standard ACLS protocol for cardiac arrest that was drilled into every medical professional. The standard protocol was a blunt instrument for a common problem. Vance was performing microsurgery on a cellular level. Ben Carter, for a reason he would never fully be able to articulate, did not look to Dr. Finch for confirmation. He looked at Nurse Vance. He saw no panic in her eyes, no doubt. He saw only an unwavering, almost inhuman focus. He saw competence. It was the purest and most powerful force he had ever witnessed. He moved instantly, his hands finding the vials and syringes on the cart, his mind running on the rails her commands had laid down. "What are you doing?" Finch shrieked, his face turning a blotchy red. "That's malpractice. The protocol's clear. You shocked the patient." He was reverting to the only thing he had left, the rulebook. He clung to it like a drowning man to a piece of driftwood, unable to see that the storm required him to swim. Vance ignored him completely. She took the syringe of calcium gluconate from Carter, her movements efficient and practiced. She found a port on the general's central line and administered the drug with a steady, controlled pressure. The calcium wouldn't fix the potassium problem, but it would stabilize the cardiac membranes, protecting the heart from the electrolyte's toxic effects, buying them precious seconds. It was a shield. Next came the insulin and dextrose, the sword. The dextrose would prevent a blood sugar crash, while the insulin would act as a key, unlocking the body's cells and forcing the excess potassium from the bloodstream back into them. "Bag him," she said to the other intern, who had been standing frozen by the door. 100% oxygen, 10 breaths per minute. The command galvanized the young woman into action. The room transformed. Where there had been chaos dictated by a panicked authority figure, there was now a quiet, focused intensity, all centered on the still form of Nurse Vance. She was the calm eye of the hurricane. She moved around the bed, checking pupils, feeling for a pulse, her hands moving with an unnerving purpose. She was not just a nurse following orders, she was a conductor leading an orchestra, a battlefield commander directing her troops. The sounds of the room changed. The panicked shouts were replaced by the rhythmic squeeze of the ambu bag, the soft click of syringes, and Vance's low, precise commands. Carter watched, his hands working almost of their own accord as he prepped the next series of medications she might call for. He was witnessing a paradigm shift. Dr. Finch, the celebrated surgeon, the titan of Ethelstan, was now just a bystander in his own patient's room. He stood, sputtering, his authority stripped from him not by a coup, but by the simple, irrefutable presence of superior competence. He was a loud, empty drum, and she was the dense, silent weight of a planet. "Charge to 100 joules, Vance said, her eyes on the monitor. The chaotic scribble of V-fib had not stopped, but it had subtly changed. The amplitude was greater. The heart was stronger, more organized thanks to the calcium. It was now ready. She took the paddles from the machine, their plastic grips cool and solid in her hands. She applied the conductive gel to the general's chest with a single, smooth motion. "Clear," she called out. Her voice was not loud, but it carried an absolute weight that made Carter and the intern instinctively recoil from the bed. She pressed the buttons. The general's body arched up from the mattress, a single violent convulsion, and then fell back. For a terrifying second, the line on the monitor was flat, a perfect horizontal green line, a systole, the absence of everything. Ben Carter felt his own heart stop in his chest. Finch let out a strangled, triumphant gasp, a sound that was half condemnation and half relief. "You've killed him," he whispered, the words dripping with venom. But Vance's eyes never left the screen. She was watching, waiting, trusting her process. And then, a flicker. A single, beautiful, perfectly formed QRS complex. It was followed by another, and another. A slow, steady sinus rhythm bloomed across the screen, a fragile but undeniable signal of life returning. The general's oxygen saturation numbers, which had been in the low 70s, began to climb. 80, 85, 92. A collective ragged breath was released by everyone in the room. Everyone except Alara Vance. She placed the paddles back on the cart, her expression unchanged. She had viewed the problem as a complex equation, and she had simply provided the solution. The successful outcome was not a cause for celebration. It was the expected result of a correctly executed procedure. She was already moving on to the next phase. "Let's start a bicarbonate drip," she said to Carter, her voice still a calm, clinical monotone. "And I want a full electrolyte panel stat. We need to monitor for rebound hyperkalemia." She was no longer saving his life. She was managing his recovery. Dr. Finch stood frozen, his face a mask of disbelief and incandescent rage. He had been rendered utterly irrelevant. In the span of 5 minutes, his entire world, a world built on a foundation of perceived authority and unshakable ego, had been demolished by a quiet nurse who had refused to play by his rules. He saw the looks in the eyes of the interns, the awe directed not at him, but at her. The reverence he had so carefully cultivated was gone, transferred to this unassuming woman. His humiliation was a physical thing, a hot, acrid taste in the back of his throat. He opened his mouth to say something, to reassert himself, but no words came out. What could he say? The evidence of his failure and her success was beating steadily on the monitor before him. He was a bug in the code she had just rewritten. The aftermath was a strange, suspended period of quiet efficiency. Under Vance's continued direction, General Thorne was stabilized. The bicarbonate drip was started, blood was drawn for the lab, and his vital signs were monitored with a hawk-like intensity. Vance charted everything with meticulous, almost microscopic detail, her penmanship a series of precise, block-like letters. She documented the initial readings, Finch's orders, her own interventions, the exact time of each medication's administration, and the corresponding physiological response. It was not just a medical chart, it was a weapon, and she was loading every chamber. Word of the incident spread through the hospital's nervous system with the speed of a neural impulse. The code blue in the Prometheus wing, especially for a patient of General Thorne's stature, was a major event. Within 30 minutes, the recovery suite's observation room began to fill with solemn, powerful figures. The chief of medicine arrived, followed by the hospital administrator, a formidable woman named Evelyn Reed. Then came the military. A stern-faced Navy admiral, his uniform crisp and laden with ribbons, entered the room, his presence immediately sucking the remaining air out of it. This was Admiral Carrick, a man who answered only to the Joint Chiefs and arguably God. Dr. Finch, who had retreated to the observation room, saw his opportunity for redemption. His panic had subsided, replaced by the cold, calculating fury of a cornered animal. He immediately approached Admiral Carrick and Administrator Reed, his voice once again finding its theatrical resonance. He began to construct his narrative, a carefully woven tapestry of lies and half-truths. It was a sudden, unprecedented cardiac event, Finch explained, his hands gesturing to emphasize his points. A 1-in-a-million complication. I had the situation under control, but the new nurse, he gestured dismissively toward the suite where Vance was still tending to the patient, panicked. She interfered. She administered a cocktail of unapproved, off-protocol medications against my direct orders. It's a miracle the general survived her recklessness. I managed to stabilize him, but it was a near thing. She must be held accountable for her gross insubordination. Ben Carter stood at the back, listening to Finch's performance. It was a masterful piece of fiction. Finch painted himself as the calm, heroic center of the storm, battling not only the patient's failing heart, but also the incompetence of his own staff. He was plausible, confident, and utterly shameless. Carter felt a surge of nauseating anger. He opened his mouth to speak, to defend Vance, but the icy glare from Administrator Reed and the stony impassivity of the Admiral froze the words in his throat. He was a resident. His word against that of the Chief of Cardiothoracic Surgery would be less than nothing. Administrator Reed's face was grim. Insubordination during a code blue is grounds for immediate termination and a review by the nursing board. Admiral, I assure you, we will handle this internally and with the utmost severity. Admiral Carrick said nothing. His eyes, the color of a stormy sea, were fixed on the glass window looking into the recovery suite. He was watching Nurse Vance. He watched her check the IV drip rate, adjust the general's pillow by a fraction of an inch, and speak in a low, calming voice to the now conscious but groggy patient. He saw not panic or recklessness, but a profound and unsettling calmness. He saw a level of focus that he had only ever witnessed in one other type of person, elite special operators in the midst of a lethal engagement. I want a full, formal debriefing, the Admiral stated, his voice a low, gravelly rumble. In 1 hour. I want everyone who was in that room present. I want all telemetry data, all security footage, and all personnel logs, everything. He did not look at Finch or Reed when he spoke. His gaze remained locked on Vance. And I specifically want to hear from the nurse. The debriefing was held in the hospital's main conference room, a cold, mahogany-paneled chamber designed for precisely this kind of inquisition. The air was thick with tension. Finch sat at one end of the long table, flanked by the hospital's legal counsel. He looked composed, confident, ready to deliver the killing blow to a subordinate's career to save his own. Administrator Reed and the Chief of Medicine sat in the middle, their faces impassive masks of corporate concern. At the far end of the table sat Dr. Ben Carter, the other intern, and Nurse Alara Vance. Carter was sweating, his heart pounding against his ribs. Vance, by contrast, looked as if she were waiting for a bus. She sat perfectly upright, her hands resting calmly in her lap, her breathing slow and even. Admiral Carrick presided, sitting at the head of the table like a judge. He began without preamble. Dr. Finch, give me your report. Finch launched into his pre-rehearsed narrative, his voice smooth and convincing. He detailed the routine nature of the procedure, the sudden and unexpected crisis, and his heroic efforts. When he came to Vance's role, his voice dripped with condescension and professional outrage. She administered calcium gluconate and a high-dose insulin bolus for a standard ventricular fibrillation event. It is a dangerous and unorthodox treatment that is not supported by any established ACLS protocol. Her actions were a wild gamble, a shot in the dark that needlessly endangered the general's life. I was forced to countermand her and administer the defibrillation that ultimately saved him. He finished his testimony and sat back, a look of grim satisfaction on his face. He had laid the trap perfectly. The case seemed open and shut. A rogue nurse had violated protocol, and he, the senior physician, had saved the day. Admiral Carrick listened without interruption. When Finch was done, he let the silence hang in the room for a long moment before turning his gaze to the other end of the table. "Nurse Vance, your response." Alara Vance did not look at Finch. She looked directly at the Admiral. She placed a small, unassuming data slate on the table in front of her. "My response is the data," she said, her voice even and clear. She tapped the screen. The large holographic display at the end of the room flickered to life. The first image was a graph of the General's telemetry data from the hour preceding the event. "At 14:32 hours, Vance began, her voice clinical and precise, "I noted a trend of decreasing serum potassium and a corresponding 0.02-second widening of the QRS complex. I verbally reported this to Dr. Finch." A time-stamped audio file played, her own calm voice from the observation room, followed by Finch's dismissive, mocking reply. Finch's face tightened. "At 15:04, she continued, tapping the screen again, "the cardiac event began. The initial telemetry showed a classic sign of hyperkalemic cardiotoxicity, not standard VFib, specifically the sine wave pattern." The display zoomed in on the jagged red line, and she overlaid a textbook diagram of a hyperkalemia-induced arrhythmia. The match was perfect, undeniable. Standard defibrillation under these conditions has a success rate of less than 5% and carries a high risk of inducing irreversible asystole or electromechanical dissociation. She brought up a new screen. It was a split view of the security camera footage from the room and the real-time telemetry. On one side, the camera showed Finch fumbling with the paddles, his hands shaking. On the other, the data showed the General's condition worsening with each passing second. The established protocol Dr. Finch refers to is designed for normokalemic patients. Applying it here would have been a fatal error. She then walked them through her own intervention, step by step. With each action, she displayed the corresponding data. The administration of calcium gluconate at 15:05:30 resulted in a 30% reduction in T-wave amplitude within 60 seconds, indicating successful membrane stabilization. The graph on the screen proved her point with cold, hard numbers. The insulin and dextrose bolus at 15:06:15 initiated a measurable downward trend in serum potassium, which we can extrapolate from the narrowing of the QRS complex. Finally, she came to the defibrillation. At 15:07:45, with the cardiac membrane stabilized and the potassium partially shifted, I administered a low-energy 100-joule biphasic shock. The patient achieved immediate and sustained conversion to sinus rhythm. She concluded, "Every action taken was a direct data-driven response to a specific, life-threatening biochemical state. It was not a gamble. It was a correction." She finished, and the room was utterly silent. She had not accused or attacked. She had simply presented the truth, laid out in a sequence of irrefutable facts and figures. Her presentation was a clinical evisceration. She had used the data like a scalpel, methodically dissecting Finch's incompetence, his panic, and his lies, leaving them exposed for all to see. Finch was pale, his bravado utterly gone. He looked from the damning evidence on the screen to the stony faces around the table. This is a fabrication. The data can be manipulated," he stammered, his voice thin and reedy. As if on cue, the heavy doors to the conference room swung open. Two men in nondescript dark suits entered the room. They moved with the same quiet, unnerving efficiency as Vance. They did not look at anyone except Admiral Carrick. One of them handed the Admiral a sealed file. "Sir," the man said, his voice a low monotone, "we were alerted by a priority medical flag on General Thorne's file. We have a vested interest in his continued health." Admiral Carrick opened the file. He read the first page, his eyebrows rising slightly. He looked down the long table at Alara Vance, and for the first time, a look of profound understanding dawned on his face. "Ethelstan Memorial has a policy," he said, his voice dangerously quiet, "of running extensive background checks on all personnel assigned to the Prometheus wing. Administrator Reed, I assume you are familiar with Nurse Vance's file. Administrator Reed looked flustered. Yes, of course, Admiral. Her record is exemplary. Top of her class at Johns Hopkins. Excellent references. Did you read the addendum? Carrick interrupted, his voice like chipping ice. The one that is sealed by the authority of the National Security Act? He slid the file across the polished table. Reed picked it up, her hands trembling slightly. She read it, and the color drained from her face. She looked up from the page, her eyes wide with shock, and stared at Vance as if seeing her for the first time. The Admiral addressed the room. It seems Nurse Vance's medical expertise is not limited to civilian nursing. For 6 years, she was the lead medical officer for a Tier 1 Special Missions Unit. Her official designation was Field Surgical Specialist and Resuscitation Officer. Her file contains commendations for performing life-saving surgical procedures under direct enemy fire in environments with zero support. She is, according to this document, one of the foremost experts in the world on treating complex trauma and atypical metabolic crises outside of a hospital setting. He let that sink in. It also seems, he added, looking directly at the two men in suits, that she is still considered a national security asset on extended professional development leave, which is why these gentlemen from the Central Intelligence Agency are here. The revelation fell upon the room with the force of a physical blow. Finch looked like he had been struck by lightning. This quiet, unassuming nurse was not just a nurse. She was a ghost, a warrior medic from the shadow world, a place where competence was the only currency and ego was a liability that got people killed. His attempts to belittle her now seemed not just arrogant, but suicidally foolish. He had tried to outmaneuver a grandmaster in a game he didn't even understand. "Dr. Finch," Admiral Carrick said, his voice now devoid of all warmth, "your actions today were not just incompetent, they were cowardly. You abandoned your patient, you abdicated your responsibility, and then you attempted to destroy the career of the one person in that room who possessed the skill to save him. You are a disgrace to your profession and to this hospital." He turned to Administrator Reed. "His employment here is terminated, effective immediately, and I will be personally recommending to the American Medical Association that his license to practice medicine be permanently revoked." Finch made a small, choking sound. His career, his reputation, his entire identity had been dismantled in less than 15 minutes. He was broken. The two men in suits moved to stand behind him, their presence a silent, final judgment. The reckoning was complete. Later that evening, after the storm had passed and Finch had been escorted from the premises like a common criminal, a quiet request came from the general's suite. He wanted to see Nurse Vance. Ben Carter, who had been unofficially assigned to assist Vance for the remainder of his shift, accompanied her. He felt a profound sense of reverence in her presence now, as if he were walking alongside a mythical figure. They entered the room to find General Marcus Thorne sitting up in bed. He was weak, but his eyes were clear and sharp. Admiral Carrick stood by his bedside. The general looked at Vance as she approached, his gaze intense. He was a man who had spent a lifetime judging the character of men and women, a skill he valued more than any other. "They tell me," the general said, his voice raspy but firm, "that you broke the rules to save my life." Vance simply nodded. "The rules did not apply to the situation, sir." The general held her gaze for a long moment. He saw no pride in her eyes, no desire for praise. He saw only a quiet, unshakable dedication to the task. He saw the same quality he had seen in the best soldiers he had ever commanded, a complete absence of self, a total devotion to the mission. He had built his life on the principle of duty, and he recognized its purest form standing before him. Slowly, with a strength that seemed to surprise even himself, General Thorne raised his right hand to his temple. He held it there, his arm trembling with the effort, in a formal, perfect military salute. It was a gesture of profound respect, the highest honor a man like him could bestow. The soldier saluting his savior. The legend acknowledging a legend. Admiral Carrick, standing beside him, did the same, his own hand snapping to his brow in a crisp, silent tribute. Alara Vance did not react with emotion. She did not smile or weep. She simply stood in the quiet of the hospital room and met the general's gaze. She gave a small, almost imperceptible nod of acknowledgement. The correction was complete. The system had been balanced. Her work was done. The next day, the Prometheus wing was abuzz with the story. The tale of the quiet nurse who had faced down the arrogant surgeon and saved a living legend was already becoming myth. But when the junior doctors and nurses looked for Alara Vance, she was not there to receive their accolades or answer their awestruck questions. She was in the general ward on another floor, quietly checking the vitals of an elderly patient recovering from pneumonia. She moved with the same silent grace, her expression the same mask of calm neutrality. The world might now see her as a hero, a hidden master revealed. But for her, nothing had changed. There was only the work. There was only the endless complex system of the human body and her quiet, unwavering vow to understand and protect it. The noise of the world, the praise and the politics was just static. The signal, the only thing that mattered, was the steady, rhythmic beat of a heart she had refused to let fall silent. And in the quiet competence of her service, she found the only validation she would ever need. Ben Carter, watching her from the end of the hall, finally understood. True strength did not need to announce itself. It did not need a title or a rank. It simply needed to be there when it mattered most, a silent, immovable force against the chaos.